This video is sponsored by Standard Dose, which is my free weekly newsletter which is loaded with insightful health tips for your everyday health. I mean, it's entirely free to subscribe using the link down in the description, so be sure to check it out. It's completely free. Hello and welcome to today's video. My name is Manny and I'm a USRN. So 4 years ago, a company called Diligent Robotics created a robot.
Pardon me, may I get to that spot, please?
Meet Moxy, the robot.
Hello.
Which they say is meant to act as a support staff and give nurses a helping hand in going about their duties, considering that nurses here in the US and in many other countries spend about 30% of their day gathering supplies for their day-to-day staff. Now, some hospitals actually tried the robot out and they said it helped them undergo errands and free time for nurses to focus on their clinical tasks. Now, the catch, however, is that this company did indicate clearly that their robot isn't designed to replace nurses in their jobs. Now, keep in mind that this is nearly half a decade ago and a lot of things has changed. Today, however, there's a new technology by an AI company known as NVIDIA, and this time it's not a robot like Moxy that we saw in the past. It's an AI software that is specifically built to replace nurses. So not all nurses, it is some nurses, and I'll talk about that in the video. Now, the company says that the purpose of this AI is to help solve the staffing shortage here in the US. Now, in considering that nurses complain about so much work and being burned out a lot, the expectation was that nurses will embrace this savior of a technology. But nurses in the US don't like it, and I bet if you're a nurse watching this video, you probably have seen this video.
How are you doing after your appendectomy?
You know, I'm good. I'm glad to be home with my dog, Dennis.
It's great to hear that you're back home with Dennis. I noticed that Dr. Chang has prescribed you some antibiotics, specifically ciprofloxacin and metronidazole, due to your ruptured appendix. Were you able to get these medications?
I was. I did forget to mention to the doctor that I am allergic to penicillin. Is it still okay to take the medications?
Great question. The antibiotics you've been prescribed, ciprofloxacin and metronidazole, don't contain penicillin. So it's perfectly safe for you to take them. Can you begin taking them today?
Yeah, I certainly can. Do you have any tips for faster recovery?
Given that you have diabetes, keeping your blood sugar levels in check will be beneficial for your wound healing.
Guys, this is interesting. So this video, the video you just watched, seems to have sent the nursing fraternity into a frenzy. Nurses in Kaiser Permanente in California here in the US are striking over the introduction of this AI by their hospital. When you go on LinkedIn, leading nurse voices are calling out tech developers and even blaming some nurses for giving advice for some of these tech companies to build software which ostensibly is going to take out nurses or is going to take the jobs of nurses in the near future. Now, I do agree that this AI is threatening and shows a lot of potential at the minute, but the bigger question I believe to ask is that, is it just a threat on nursing, or we're about to witness the revolution of the whole healthcare industry, considering that the core function of nurses in the world involves things like inserting IV lines, changing a Foley catheter, or doing so many tasks that involve human-to-human interactions, which can obviously not be done by the AI. The other thing is that the use of AI in healthcare isn't a new phenomenon here in the US nor in other parts of the world. Now, but before we get into other countries to see what's happening with AI, I want you to give this video a thumbs up and leave a comment down below and let me know what you think. You can also subscribe if you're feeling particularly generous, and thank you for doing just that. So AI is already being deployed in several parts of the world. In the UK NHS, for instance, AI is already being used in interpreting X-rays, brain scans, mammograms, and in diagnosing life-changing medical conditions like breast cancers, dementia, brain tumors, among others. And the NHS says that this is freeing up radiologists and giving them more time to see their patients with better rates of accuracy. That sounds to me like a polite way of rendering someone redundant from their job. Now, if you go to Germany, Thorax Scan, which is the name of their groundbreaking AI, is used to interpret chest X-rays also and standardize pathology reports, and is believed to free up about 30% of doctors' time. Then there is China, which is being more cautious in the use of AI in healthcare. Now, they were one of the leaders in starting AI innovations in healthcare, but Beijing is now imposing restrictions on the use of generative AI in online healthcare activities. So all in all, the use of AI in healthcare is not a new concept. So I'm just building a point here to bring your mind to why US nurses are concerned. So if you go onto the website, that's hippocraticai.com, this AI has multifunctional modalities, and as you can see here, okay, so you choose a role. It has pre-op, it has discharge, it has chronic care, it has nutritionist, okay, it has a payer, which I believe is for billing, VBC, pharma, and pharmacy, and it goes on and on, assisted living and all of that. So for the purpose of this video, let's just say we choose a pre-op AI modality, and then let's just say we are going to have someone do a colonoscopy, okay? And so you need pre-op colonoscopy, and then you have Jasmine and Nancy. So let's just say we choose Nancy. Now, it's telling you that Jasmine is designed to check with the patient prior to their colonoscopy appointment and focuses on pre-procedure instructions for their upcoming appointment, including arrival details, diet, bowel prep. I mean, things that a nurse would do. And this AI model is doing it for less than $9 an hour. So, but what does it actually do? This gives you the ranking, but if you go further down, okay, it's going to tell you what it does. Now, it says that the pre-op colonoscopy call checklist includes appointment confirmation and check-in details. So you can see that the AI called in the video. There's medication review. It can do that. It can do diet change instructions, bowel preparation, colonoscopy preview, transportation arrangements, symptoms check. Guys, this AI can do a host of many things that pre-op nurses will be able to also do. But the only thing is that it's doing it at a cheaper rate. Then there's Nancy, there's Yolanda, which is also pre-op tonsillectomy. So let's just say you choose chronic care. You can have chronic kidney disease or obesity, chronic heart failure, and these nurses are going to do that. So, I mean, you just choose and then you select to test. I did fill out this form and I got a notification that they'll get back to me, but I didn't get a chance to test it before at the time of filming this video. So guys, this gives you an overview of what this AI is meant to do or what you can actually do and the potential going forward for this AI. So the report did show that comparing the Hippocratic AI to human nurses, the Hippocratic AI is more accurate than human nurses at certain tasks, and that's expected. For example, in identifying medications' impact on lab values, the AI performed 79% and human nurses performed 63%. I mean, for example, if you are taking Tylenol or acetaminophen, your blood sugar may be elevated, which is a false elevation, but that doesn't mean that you are diabetic. Now, it says that the AI is better at identifying that as compared to human nurses, which is just an issue of data, so it does make sense to a certain extent. Now, when it comes to detecting toxic dosages of over-the-counter medications, I mean, it doesn't really match. It's a whopping 80 to 50. So that's a huge margin. Now, guys, here's the catch, which is what I think is going to attract a lot of health entrepreneurs here in the US. It does all of this with a higher accuracy at a fraction of the cost. It's $9 an hour for the AI model, and the median salary of a registered nurse here in the US is $39 per hour. So in simple terms, this Hippocratic company is saying that the AI is charging you a quarter of what a registered nurse here in the US earns to do a better job for you based on the data that we saw earlier. I don't know how this is true, but and nurses aren't happy. So frankly, these roles are normally performed by outpatient clinic nurses, which are in the obvious minority when you count the number of nurses in the US. But it does show the potential of what AI can do in its current form and the future it holds for our healthcare, for the health industry. Now, my estimation is that this isn't a real threat. I think that there is cause for concern, but let's not be quick to blow things out of proportion. I mean, healthcare entrepreneurs want to pay the least for the best services possible. And so it makes sense why some hospitals have already started adopting this software in its early stages. And like expected, nurses are reacting to this because nobody wants to lose their job. Now, here's my take in all of this. The AI in its current state is not flawless in the performance of every nursing task. I mean, there are certain things that it cannot do, like the core task of a ward nurse, like what I do on a daily basis, like changing a patient's Foley catheter or inserting a new one, or having to change a wound dressing, or suctioning a patient who is on a tracheostomy and has built up secretions in their throat, or administering medications, which means having to start an IV line, or many care tasks which require the physical involvement of a human being. And it's the trained kind of human kinesiology that robots cannot perform yet. And even if they did create such a robot, patients will have to decide if they want to be cared for by a robot. Now, keep in mind though that US patients have voted for nurses as their most trusted, most ethical, and most honest professionals in the healthcare industry in the US for 22 years in a row. No other profession comes close. So I'm not sure if they want to replace their nurses with robots or with AI, and I'm not sure I'd like that for myself either. Plus, the current hospital and ward structure is simply not optimized for use by robots and AI. Now, in this current age of wild technological advancements, I mean, it would be completely stupid for anybody to rule things out or to rule out the possibility of mind-blowing technological inventions that will change the face of nursing in the US and in many countries across the world. But the fact remains that patients have a huge role to play in choosing the kind of care they want. That is, whether they want human-to-human interactions or they want robot-to-human interactions. Now, let me conclude by saying that the anxiety and concern is palpable, especially when you peruse forums on platforms like Reddit, among others. Now, that's true, but suffice to say that before nurses will get replaced, considering that nurses do the bulk of human-to-human interaction roles in the hospital, other specialists like radiologists, physicians, pharmacists, and biomedical scientists who do not really have a lot of human-to-human interactions may also have to be in a queue looking for other jobs before a medic robot, if I'm able to use that word, but taking the jobs of the core staff of the US healthcare industry will be a tough task. Now remember to subscribe to the newsletter with the link down in the description. Give this video a like and subscribe to the channel. And thanks for watching. I'll catch you in the next one.